Good afternoon, everyone, and welcome to NASM Live, Optima Online. My name is Prentiss, and I am here with Kevin Longoria, the Chief Science Officer of Biostrap, and Stull, International Man of Mystery. How are you gentlemen doing today?
Doing great.
Okay.
Doing very well, thank you.
All right, and as always, I'm here. We are here with Greg, our producer, who's making everything run smoothly in the background. And just be sure to, as we go through this webinar today, you can ask questions along the way, and we will have a Q&A at the very end of the webinar. So we are talking today about, we're continuing our discussion about HRV, and we're using data to drive our programming today. So we are getting signs from the telltale heart to give us information into what we should put or how we should structure our programming today. So let's go ahead and go to the next slide. Okay, so today it's very simple. We're going to do a very brief review of some of the things we talked about in the previous two webinars. We're going to go through 3 case studies and have some Q&A at the end. There will be a promotion for one of the NASM courses and the medical breather, which the name is escaping me right now. And for those of you who hang on until the end, we are going to give away a CES course. We're going to give away the new CES course, so you'll want to hang on. You'll want to hang on for that at the end. So, any questions, gentlemen? Any comments before we get going?
None for me.
All right, sir, let's get it going.
All right, let's get it going. So let's go to the next slide. And so just a very brief review. Basically, heart rate variability is telling us, honestly, listen to our hearts and let that give us some information on how to program. Kevin, can you just briefly highlight what HRV is and how we're going to use that for better outcomes in our training?
Yeah, definitely. A healthy heart is not a metronome, right? We used to look at these EKG, think beats were supposed to fall very consistently, but we now know every time you breathe in, heart rate should speed up a little bit. When you breathe out, it should slow down. This little number allows us to objectively quantify our nervous system, and when utilized properly is one of the most valuable tools you can utilize to objectively assess somebody's recovery, their readiness to perform, as well as their physiological adaptations, how we can show improvements in both health and performance.
Okay, great, thank you. And now that's perfect. That summarizes everything that's going to give us the information we need to do some programming today. And let's go ahead to the next slide. And these are some of the influences on HRV. So let's talk about each of these briefly, but specifically, what are some of the influences that nutrition, and I know that you're going to mention gut health a little later, Kevin, what are some of the influences that nutrition and hydration have on your HRV?
This is at the top for a reason. Nutrition and hydration interventions are one of the most important interventions we can make to influence somebody's heart rate variability and their risk of all of the diseases and performance factors that are associated. So when it comes to hydration, just basic, drinking enough water consistently throughout the day, encouraging things like lymphatic movement through proper movement, regular movement. And then nutrition is really about supporting gut health, keeping inflammation levels low, understanding we can make you the best athlete in the world, but if you're chronically getting injured, you're not going to be too happy with our programming.
Absolutely. And so next, how does sleep influence HRV?
Sleep is the second most important, certainly. This is really when we're going to see the improvements in our HRV throughout the evening. Throughout the day, we accumulate stress. Sleep is our opportunity to recover, adapt, and form useful adaptations to that stress. So this is really understanding sleep is not as simple as sleeping, laying your head on a pillow for 8 hours a day. It's about consistency, avoiding blue light, really optimizing different components of your sleep. And with that comes the need for data. Now, the bad sleeper doesn't tell us enough. We need to understand why they're a bad sleeper, and we need to know how to fix it.
Sure, and really quickly, because sleep is, I think what we understand as lay people is poorly understood. So just a couple of things that we should, what are some things that we can do very quickly that will have a positive influence on our sleep?
A big one is avoiding too much blue light throughout the day. So we want to wear something like blue light blocking glasses, or even better, just limit our screen time. A little natural sunlight in the morning is great for kind of getting that little melatonin surge. Really, one of the most important is having a nighttime routine, really making sure that our body is able to produce melatonin naturally. Everything from brushing your teeth to laying down to trying to fall asleep and waking up the following day at the same time is all part of our circadian rhythm. The body works on a 24-hour cycle, whether we like it or not, and it's better to work with it than against it.
Okay. And yes, sir.
So in the previous webinar, Kevin, you had mentioned that the deleterious effects of alcohol could last several days. Whenever it comes to something like sleep, let's say one of you're a pretty good routine and 1 to 2 nights get completely messed up for whatever reason. An athlete, let's say, is at an away game or whatever. Does it have the same sort of a long-lasting and negative effect over several days, or as soon as you get right back to your routine, do you just get back to baseline? I don't know if that question makes sense.
It does, yeah. There is a concept of sleep debt. If you skip, say, a full 24-hour sleep cycle, you can't necessarily just sleep 8 hours the following day and get right back to baseline. So there's a little compensatory phase where you may need to sleep more, not necessarily 8 plus 8, but there is definitely a lasting impact. What we see there is you're able to actually make up from sleep deprivation a lot faster than sleep inhibition through something like alcohol or substance abuse.
Thank you.
Okay, and then, so yeah, thank you for that. And that actually did answer a follow-up question that I had. So thank you again, Kyle. So then stress management, so first of all, how does stress or chronic stress, longer than it's useful, because stress is necessary for us to go through in various areas of our lives. But when stress has ceased to be useful, what effect does that have on our autonomic nervous system?
Stress is most directly related to our cardiovascular function, where we're generally going to see increased blood pressure, decreased cardiac output. And this just has systemic effects. Now our nervous system has to work much harder to deliver the same amount of oxygen and nutrients throughout our body. So stress is correlated with, cardiovascular disease undoubtedly, but all the comorbidities that come with that. So stress management is all really about finding what works best for you, whether that be listening to some music, hitting in the gym, great cathartic act for most of us, or just, taking a few minutes to focus on your breathing, think some positive thoughts. All of these things have been clinically validated to improve heart rate variability.
Okay, and then just continue along that thought, and that'll take us very nicely into point 4. What is it? How does breathing influence our autonomic nervous system? And what are some things we can do to train that?
A lot of the nervous system comes down to how well we can utilize oxygen. What we see in most populations across the board is that we're not very good breathers. We're generally born really good breathers, and we regress to kind of chest breathing. We lose that diaphragmatic breathing. So anything you can do, from exercise, improving your aerobic capacity, to things like respiratory muscle training to strengthen your inspiratory, expiratory capacity, as well as these muscles, and strengthen all of these kind of breathing intercostals. All of these things are going to have a positive impact on your nervous system, your sleep, and your recovery.
Okay, and then Kyle, for you, going to bring you in. So when we talk about regeneration strategies, and we see the other part of our Venn diagram on the right, how does movement, proper or improper movement, influence our autonomic nervous system?
Whenever we look at proper and improper movement, so movement that's going to apply more stress to the body than it needs or than it's ready for. So one of the things we'll talk about today, or one of the things we have talked about, is readiness. So your body can be ready for a certain level of activity, a certain intensity of activity, and if you go beyond that, what your body's ready for today, that could be deleterious, or it could not be. It could be beyond what your body is capable of adapting to for that day. So that's going to be negative movement, and that's also more than likely going to send you into a bit more of a stress response. Whenever we look at proper movement, or movement when we say proper and improper, of course we can look at form and we could call something improper, but here for this, I'm talking more about a level of intensity that you're ready for. So something that is within that readiness window, if we want to call it that, it's going to increase blood flow. It should be relaxing. It should help with some of that, could help with some of the stress management, improving blood flow. We get the muscles to pumping and flushing out metabolic waste. So all of those types of things there could be advantageous, would be what I would call proper movement. Right intensity at the right time.
Okay. So I think that sets the case for us nicely. We want to monitor all of these 4 factors because they are going to have an influence on heart rate variability and also some of the outcomes that we're looking for our clients in the training setting. So now let's go ahead and get into these case studies. We're going to talk about Bob. We want to know, what about Bob? He's a CEO. CEO comes with a high stress situation. He's working 50 hours a week. He's sitting for long periods of time. He drinks 5 cups of coffee a day. I'm a coffee drinker. It looks like Bob's not that motivated. So Kevin, can you explain, and he sleeps 5 to 6 hours a night, but can you talk to us about the other 2 bullets and how that's going to influence our programming? What are some things that we know? What can we learn with these 2 bullets here?
Yeah, so the 5 to 6 hours sleep is probably pretty generous for Bob. What we see here is just he's prioritized work over his health. Right? So he's not even probably heard of a metric like heart rate variability. He's not getting his regular physical activity. So while he may feel like he's optimal cognitive function wise, because he may be doing well in work, he's not optimal. And this is where we're going to focus on developing a prioritization model as a function of our client. We have to understand their wants, their needs, and their goals. And we're going to develop a program that's very realistic, but kind of matches the idealistic approach as well. Of course, we would like to get Bob doing rigorous exercise, doing high intensity interval training. Bob probably isn't going to do that. So what we need to understand is how to relate to him and how to get him to prioritize health, basically just kind of chopping away until we get him to a threshold where maybe he will adopt a bigger lifestyle change.
Okay, great. So now let's see what you did for Bob. Let's go to the next slide and talk a little bit about his wellness program.
So you'll see with all of these, they start with education, and this is really what I want to dive into. And I don't want to generalize here. I've worked with many corporate executives, and I've always tried to make the case of, you're working so hard to make all of this money, but are you going to be able to enjoy this money when it's all over, right? You want to live long enough to enjoy all of that. So try and prioritize your health a little bit. That tends to not be that effective, surprisingly. So what I've found with this population is you have to show them how this lifestyle change, how health is going to make them better at their job, right? So this, for Bob, it's going to be cognitive performance. So we want to cite some research around, low heart rate variability is independently associated with worse short and long-term memory. So let's get you a little more active, sleeping a little better. We're going to get your heart rate variability up, and now you're going to be able to remember things better for that next meeting. Or other studies have shown that this increases the likelihood of dementia and stroke. We don't necessarily want to always take this fear-based approach, but sometimes that can get clients motivated. A very strong correlation also exists between prefrontal subcortical decision-making, right? So to get very simple there, this is the executive decision-making part of our brain. how we can quickly and flexibly respond to environmental factors, right? These guys need to be able to make a decision, a very important one on the spot. Heart rate variability increases, your ability to make these types of decisions. So we just really want to relate to him, his specific needs and his goals before we even start talking about the program.
Okay. Okay, so now let's, and Kyle, do you have any questions about that?
I don't, no.
Okay, so let's start with his interventions. Obviously, the 5 cups of coffee a day, probably not ideal for anyone. What did you do? What did you recommend to him regarding his hydration?
So number one, we just talk about trying to improve our hydration and possibly cut out a little bit of that coffee. I have met with many clients who, I put water in my coffee. That's a true story. A lot of people think that they're actually getting fluid intake from that, when really we understand caffeine is a diuretic. So not only is this not working towards your hydration goal, it's actually working against it. So there's some research to show, even with the caffeine, maybe it's hard to pull that out of his diet, but just by adding a liter of water per day, we've shown about a 12% increase in heart rate variability over 1 month. So let's just get him drinking a little bit more water, right? We don't want to impede on your lifestyle. Let's get you drinking a little more water, see if you feel any different. Then when it comes to the nutrition, Bob probably travels quite a bit. Maybe he eats at some nice restaurants. Maybe he's eating high quality food. So what we should really focus on here is the don't eats. And this kind of includes the beverages as well. Let's start on cutting out a little bit of the gluten or those starchy carbohydrates, and let's try and get a little bit more of these phytonutrients, right? Let's play the rainbow with our vegetables a little bit. Let's try and avoid dairy and soy. So with this population, I specifically see, instead of trying to completely revamp a nutrition program, really phase-based, let's take this out, let's take this out, because we know they will feel better. They're going to feel that decreased inflammation, but they're also going to see their numbers increase. Bob's a competitive guy. That's how he got where he is today. So when he's seeing that little recovery score and sleep score increase, he's going to be more motivated.
Okay.
Yep.
So on the nutritional, would you recommend a particular meal, 1 to 2 meals per day that would include the don't eats, or don't eats all across the board? So don't eat, you cut down on the gluten, for example, all day long, or would it be for dinner, let's start by cutting out this or this?
What I've found to be more sustainable, as opposed to say a 2 out of 3 meal type of approach, is more of a 5 out of 7 day approach. Let's be good 5 days a week, and 2 days a week go live your life. And I personally, I don't have much research to back that up, but we all need flexibility for sustainability, right? So I've found, especially if you're eating that bad meal right before bed every single night, you ate great during the day, but that bad meal's right before bed, now we're disrupting your sleep and your recovery. So I'd rather get 5 really good days, let you see this increase. Oh, now you cheat over the weekend, and now you're intrinsically feeling bad because you see your scores go down.
Yeah, and I think it's important too to stress that, a lot of times whenever we go in super hardcore and try to initiate some of these changes very quickly with any client, a lot of times it can turn them away from the program. So it's better to try to ease into it, just like you're saying, and try to get them to make some good decisions, and that would hopefully motivate more good decisions whenever they start to see their numbers improve.
Exactly. Cool. So the next thing we want to talk about with Bob is circadian consistency. With this population, trying to get them to sleep more is not always going to be effective because they have work to do. They're not going to sacrifice their work for sleep. So what we want to focus on is, Bob, let's just try and at least sleep at the same time every single day. Let's maybe try and turn that computer off for an hour or 2 before bed, avoid some of that blue light. Let's try and get you in bed by, midnight every single night, and you can wake up at 5, 6 a.m. and get right back to work, but we want to focus on this consistency. Once again, hopefully Bob follows it. We want to reinforce him for that, but he's going to see these little scores. We have a little circadian score, 0 to 100, and this consistency factor is going to that alone is going to reinforce him.
Okay. And real quickly, I wanted to go back to don't eats. Now, is the reason, and this is more of a question about semantics, because we eventually want our clients to not eat certain things in favor of others. But does the way you frame that have to deal with his position and his mindset? So if I tell, most people not, instead of asking them, will you consider doing this behavior instead?
Yeah, it's all part of the phase-based program. So if we can start with pooling things out, now we're going to start pushing some things in as well. So once again, it's all just about sustainability. And if we're switching foods out for foods they don't like, trying to get them to have kale instead of a potato with dinner, they're probably not going to follow it. But maybe we can just pull that bad thing out, start to get them to feel good, and then they're going to want to make better decisions. They're going to start to trust you when they see that these interventions you're making are in fact moving the needle for their health and performance. Now they might be more likely to listen to you with the add-ins.
Okay. All right. Thank you for that. And then finally, on his interventions, we're talking about hourly movement. So if you have someone, I want to hear this strategy. You have someone who's singularly focused on achieving their goals. How do you get them up every hour to do something?
So with our wearable, we have some luxuries, right? We have a little algorithm, their activity score, that does factor hourly movement in. So they're going to hopefully compete for that little number. But there's also these little insights, right? We can send them a notification if they haven't got X number of steps for the last few hours. You as the trainer can log in and see their data anytime, real time. You can see right now, has Bob gotten up and taken steps for the last few hours, and you send him a little text message. But once again, it all just comes down to, Bob, let's start slow. Let's get you moving a little bit more often. Try to, not sit in that chair hunchback for 6 hours straight. Let's get up. Let's stretch a little bit. Let's breathe. This is going to actually help you with your work. You're going to get a little stress relief, and you're going to be more cognitively focused. And then they're going to start to just hopefully see some improvements in other aspects of their health as well.
Okay, great. Thank you for those explanations. And before we get into your area of expertise, Kyle, do you have any questions or comments about these interventions so far?
Just a quick comment on the hourly movement. So whenever I was doing my doctoral work at university, there was a professor there that he decided to set up a little study with the administrative staff, and what he got the university to buy them all standing desk, and this was unpublished, very unofficial. He just kind of wanted to see what would happen. He got the university to buy them all standing desk, and they wrote up a walking program, and I forget the specifics. I don't know how long they were standing. I don't know how often they were walking, but it was supposed to be, I believe they were going to track this over 6 weeks and see what kind of changes were made. And it turned out that nobody made it to 6 weeks because their feet started hurting too bad from all the standing and walking. So the point of that story there is whenever we see things like hourly movement, we have to keep in mind that if we're taking a population that's been sitting, on their rear working for, in some cases 20, 30 years, basically, we want to make sure we're not throwing them into something to where they're standing at their desk for hours per day and they're walking and they're doing these things. Just like everything else, just kind of ease them into it and just encourage them to stand for a little bit, to take a few steps, to walk around the building one time, just small steps there, so we're not really throwing them to the other end of that spectrum of moving so much that they start to get painful feet.
Okay, outstanding. Now, speaking of painful feet and doing too much too soon and driving in poor movement habits, what are we going to do regarding his? Let's go back to the last slide and tell us what you did. Tell us why you chose this particular corrective exercise protocol.
Yeah. So first of all, whenever we look at corrective, it's important to understand that we base our corrective strategies off of a comprehensive movement assessment. So we have our systematic approach where we start with static posture, we work through the transitional assessments, and then we do range of motion. So we're making some assumptions here. Whenever you're working with this population, we would encourage you to go through that assessment flow and make sure that we're designing the program that is best for them. Here we're making some assumptions based on his levels of stress and the picture that we just looked at. So what we would want to do is a quick and concise corrective program, something that Bob can do in his office within a minute. So we're looking at something that's around 10 minutes, maybe a little bit less, maybe a little bit more, depending on how quickly he moves through these. So we would want to start off with trying to relax some of the upper body. So whenever we look at our 4 phases, we have inhibit, which we would use self-myofascial rolling or myofascial techniques, foam rolling, whatever you want to call it. So we'd want to inhibit, and that's going to essentially down-regulate those muscles. So it's going to basically turn them off a little bit. Then we're going to try to add a little bit of extensibility with some lengthening techniques. Those are going to be for our muscles that we identify as being short and overactive. Then we'll look at some activation. So this is kind of the opposite, where you can think of it as being up-regulating or activating, turning these muscles on. That's going to provide us some stability. Then we're going to finish that up with integration, and this is going to be just like the name implies there with integration. We're going to coordinate some movement patterns. These be total body for Bob here. We just have a couple of upper body things, but going back to inhibit. So the first thing I would have him do, I would encourage Bob to get some sort of a rolling device. So it could be a softball, it could be a massage ball, it could be, if Bob's real fancy, maybe he invests in one of those percussion devices, and we would want to use that. Let's say we just had a massage ball. He could get up against the wall to try to get into his pec. So we'd want to get into the pec minor there. We're just applying some pressure. We can see that these are also done in a standing or seated position. So that way Bob doesn't really have to lay out on the floor of his office to do this. So we'd want to release or inhibit the pec on the wall. And then if he had that same massage ball, maybe he has 2 massage balls or lacrosse balls. While he's seated in his chair, he could position those right in the thoracic spine and lean back into it. That's going to, those muscles there usually aren't overactive, but that's going to help get him a little bit of thoracic extension, help him open up here in the front a little bit. From there, I would have him go over and just do one stretch. So going over to the doorway stretch, throwing the arms up here. It's great for the pecs, but again, it also just kind of helps him open up there in the anterior aspect of the thorax. That's going to help his breathing as well. Right, whenever we leave from that, he can just step away from the door and we'll get into some activation. So standing cobra, this could be kind of a half bent over position. And our cobra is really just working on scapular retraction and depression. So once we inhibit and lengthen the muscles here, then we're going to try to activate by retracting and depressing. The next one I have over there, and I'm going to turn this to do a demonstration, hopefully, a little bookshelf rotation. Again, with him standing, if he has a bookshelf, he can just throw his arm up here and get worked through rotation. This can be activation of the rotator cuff, really just getting some movement there through the shoulder. The reason I would set my arm on the bookshelf here is to try to not get too much activation from that middle deltoid. If we're holding our arm up here, a lot of times that middle delt will kind of lift that glenohumeral, or it'll lift the humerus there. So if we throw the arm up, we can get that to relax, and we can actually get a little bit more out of the rotator cuff. And then whenever we get to the activation there, standing scaption, that's really just going to get us some motion through that scapulothoracic joint and coordinate that with the glenohumeral joint. Scaption raise, thumbs out here. We're typically moving about the same angle that the scapula sits on the posterior aspect of the thorax. I like to put the thumbs up. We can just go through a standing scaption there. If Bob doesn't mind getting a little bit fancy in his office, he could do single leg scaption to try to coordinate that a little better. The last one I put down there is a push-up. Should be a push-up plus if we're familiar with that. It's where we're getting a little bit more serratus anterior activation. I put the little star by that because Bob may or may not want to get down on the ground to do his push-up. He could do a little push-up on a wall, or he could do any variety of push-ups. That's also going to be another great core activation exercise while he's doing that. So once you teach him that, again, he should be able to move through those very quickly. This could be something that's 8 to 10 minutes, and that could be his hourly movement, or maybe he goes through that 1 hour, and then the next hour he goes for a little walk or something along those lines.
So thank you for that. You've actually answered all questions that I had, and so now let's move on to case study 2. We have someone a little bit different. Okay, we have Ann. Ann's a professional athlete. Looks like she's a professional athlete in my sport. Now, when we say that she has repetitive stress, does she have repetitive stress injuries from her training, or what do we mean by that?
So just repetitive motion. So
repetitive motion. Okay. All right. Yeah. Just from the training. Okay. Increased risk injury. She's significant travel, and she's training with a team. Okay, Kevin, can you tell us a little more about her biometrics? What we found there.
Yeah, we see that Ann is doing a lot of things right. She has a good VO2 max, even heart rate variability is not bad, but the travel is having a big impact on her sleep and her ability to fall asleep. She trains all day, still has to come back and take care of her children at the end, and then watches some TV before she goes to bed. All of this, too much rest, not enough recovery, not enough deep sleep, seeing that her sympathetic portions of her nervous system, her stress, outweigh her sympathetic rest, digest, and recovery.
Okay. And just explain, I know that you talked about it, you touched on it very briefly. Just tell us a little bit more about sympathetic dominance.
Certainly. So we have those two branches of the nervous system. Sympathetic, always trying to respond to stress, get everything ready to respond to, demands and stressors. And then we have our parasympathetic, rest, digest, and recover. These are constantly playing a game of tug of war, literally at every single heartbeat. Over time, our body's going to make adaptations as a portion of our lifestyle. We will see, for example, smokers tend to be more sympathetic dominant because they're always applying this kind of toxic, substance into their body. So their body's always having to stress and kind of recover from that. We see other people with things like adrenal fatigue, right? They've stressed so long for so much that now their hypothalamus pituitary adrenal glands just can't keep up, and it's decided to stop doing its job. Now they fall so deep into parasympathetic that they're gloomy and mopey all the time, and they just can't produce energy. So it's really about maintaining the proper balance and understanding that balance is somewhat of a function of your goal or your sport. Okay,
and just one more quick question before we get into the program about sympathetic dominance. In your experience in working with athletes, do you see any challenges with them regarding, their gut motility, digestion, elimination? Is that something that would be a sign that we would look out for?
100%. That's why I included this for Ann. This is taken from actually one of my lead athletes that will not name. But they tend to be the type, I'll eat whatever I want because I'm high performing and I maintain a healthy body composition anyways. So they're seeing that from a very one-sided perspective, not really understanding how that relates to recovery and injury prevention, right? So they tend to eat just about anything, and this really destroys your gut. So while you may be a great performer, you're not optimal unless your gut is functioning properly, and that's why we'll see that's going to be one of my first interventions for Ann.
Okay, so let's go ahead and get into those interventions. We have Ann on the next slide, please. And while we're waiting for that to come up, Joanne has a question, and this would be directed to you, Kevin. And thank you for watching, spending time with us today, Joanne. She wants to know, is the goal here short-term change of the central nervous system or to create a long-term performance change?
Obviously, the goal is long-term. We always have to take kind of a consideration into the training phase. If we're pre-competition, we have a few weeks before the big season. We got to do the best we can to make a short-term yet somewhat sustainable. Other sports like the MMA, for example, we have a fight and then we're off for 6 or 8 months. I'm not taking 6 months off and then starting. We're trying to intervene and make long-term changes to the autonomic, but this is kind of a part of the central nervous system feedback loop.
Okay, so now, yeah.
Long-term is always the goal.
Yeah, definitely long-term. And we'll have, I'm guessing, some short-term wins, some intervention that will have a short effect, but our overall goal is to sustain that for long-term age.
Correct.
So next, let's talk about the program and how you approached education.
So with education, obviously this is an elite performer. We can educate on health undoubtedly, but what they really care about is their performance. With this, we maybe talk about some of the research we've covered over the last few weeks, how this is highly related to their injury due to its relationship with their inflammatory processes, or how improving how pre-competition stress can actually negatively impact their performance. So we need to now take the same data. Luckily, these biometrics are so agnostic, and we can find a way to actually reinforce them generally on their sport-specific function even. So we want to just relate this to how she's going to perform on the field, on the mat, or whatever that may be, with obviously a little touch on the they component as well.
Okay. Now, is this the same personality as our previous case? They're very driven.
Yeah, driven, but by different outcomes, right?
Okay, sure.
Yeah, maybe Bob wants to make some money and just wants to perform for the love of the sport, and the money does come with that.
Okay. And let's talk about, I know we had mentioned gut motility and overall digestive health in the discussion, or overall discussion very recently about sympathetic dominance, but let's talk about some of these interventions, starting with the gut.
The gut restore. So what we do with the Biostrap is we're looking at really specific biometrics of your nervous system. So heart rate variability is good from a high level, but when we can look at your sleep and your different aspects of your nervous system, we develop completely individualized gut restore programs. Here we'll just talk pretty general. Once again, kicking out something like gluten. These athletes believe carbs are their only source of fuel. We know there's a lot of research showing the importance of fat oxidation nowadays. So if we can kick out gluten, just a little story of myself, I never really believed the whole gluten bandwagon, right? I went gluten-free for 1 month, and then I went and had some sweets, and I will never have gluten again. And that is a true story. It had such an impact. I didn't really feel the detoxing from gluten, but when I introduced it back in my diet, I felt like I got hit by a truck. So little things like this where we can show them, remove it, a little elimination phase, go ahead, reintroduce it. This is where they're really going to feel the difference, and they're going to make these long-term changes.
Okay, thanks. Kyle, did you have a question regarding that?
No, just thoughts to myself about cutting out gluten. Pizza doesn't have gluten in it, does it? Pizza or Mexican food? Pizza and Mexican food?
I think that's all gluten, actually. Those new cauliflower pizza crust, though, I recommend them.
Okay, so let's talk about sleep intervention for the martial artist, and just a funny anecdote. I'm definitely amateur, haven't competed in many years, but I still, after a training session, find myself having doing these mental gymnastics after a training session. Oh my gosh, should have done this, and or not that while I was training, sparring with a partner, and just going through this. How do you get the martial artist to calm down before bed?
With most of them, I do try and get them to do some sort of post-exercise like a mindfulness meditation.
Okay.
Your goal is during training, you're going to be sympathetic, but as soon as training's over, your goal is to get back into parasympathetic quickly as you can. Kind of, and a big part of this is actually the nutrient timing, that window of insulin sensitivity, getting back into that anabolic phase. All of these hormones are related to your nervous system as well. So a big portion of that nutrition, that breathing or the mindfulness training. But the little things as well, like that nighttime routine. I have grown men brushing their teeth at the same time every single night, and turning their bedroom down to 60 to 67 degrees, whether they feel comfortable in it or not. We show them that these are in fact increasing their sleep biometrics.
Okay, and Ricardo, you brought up a great point, interesting point about nutrient timing. Now, what's that? Many of us who are more amateur coming from work into this situation, what is that window post training to get nutrition in
It's generally defined as 45 minutes.
Okay.
Up to 2 hours max, but 45 minutes. What I will generally do is about nothing for the first 20 minutes post training, because you're so sympathetic anyways, you're not going to digest and everything as well as you can.
Okay.
And you have this 20 to 45 minute window post, and this is where you want these really high glycemic carbohydrates. These ones that would be terrible for you before bed are great for you following training. And then there is this kind of general 4-to-1, 5-to-1 to protein ratio that's pretty well validated. I generally use a little bit of metabolic testing. We look at what they burned and we'll adjust that a little bit, but that's a very important component.
Okay, and just explain to us what this what the HRV guided recovery is and how that would work for us.
So with this, I like to think of Anne as understanding. Maybe she likes how her percussive therapy device feels, or she loves her Normatec, but she skips it a lot, right? She thinks it works for her, but she doesn't really know for sure. So with this, you start to really reinforce. Let's do your percussive therapy. Let's do the pre-training warm-up. Let's do the post-recovery. And now you're really going to show her that she's sleeping better, she's recovering better, using that score, but eventually this is going to translate to feeling better as well. But to this, it's HRV guided training would be great. Of course, we want to modulate her daily output as a function of her recovery with that team training environment. This has actually been things that have stopped big deals. We've tried to work with many professional teams, and they're like, so you're gonna tell me 1/3 of my team is not gonna train today because they went out and partied and they get the day off because of it? Like, I do get that, right? It's hard to apply individualized training in a team setting, but recovery is pretty individual, right? So when you start to understand how that massage and how that percussive therapy, or maybe that CBD product actually improved your recovery, now you're going to be a lot more compliant with it.
Okay, and thanks. And you've already established why breath training is important, but what are some of the protocols, breath training protocols that you would go through with an athlete like Anne?
Without a device, we always like to do, really focus on the diaphragm. So, it takes a while to cover everything we would talk about in a breath session, but make sure they're breathing properly. Things like triangle or square breathing are very simple without a device. They have sometimes some good visual cues there as well. But square breathing, for example, is 4-second inhale, 4-second hold, 4-second exhale, 4-second hold. Generally do about 10 breaths, take a little break, repeat another 10. And this is taking, a matter of about 2 minutes, and it's going to have a real-time impact on your recovery and heart rate variability.
Okay, thank you for that. I'm toggling my microphone on and off because there's a lot of noise in the background. And before we continue, Scott has a question regarding sympathetic dominance, and thank you for watching today, Scott. And he wants to know, is there a way to measure sympathetic dominance?
Yes. With our device, to the average end user, we'll just usually give them that number. But as the trainer, you're going to have access to the back end, and that's where we look at what's called frequency domain analysis. So here we're looking at the actual bandwidths produced at the level of the heart, and not to get too complex, but we'll look at ultra low frequency, very low frequency, and high frequency. We know that high frequency is almost 100% parasympathetic driven, whereas the other bandwidths have specific properties that are both sympathetic and parasympathetic. So we'll actually look at what's called the LF to HF ratio, and this will see, are we leaning too much towards one side or the other? So it's rather easy to interpret because we give you like a little bar graph and you want them to be even, and you can see if we're teeter-tottering too much one direction. But when you start to understand how these bandwidths work, then you can start to understand, well, this bandwidth is associated with lack of deep sleep. that is presenting here. So we know it's not just this 5-day baseline. They've been lacking deep sleep for a long time, or this is more related to adrenal function. So the interpretation, and that's why I hope to develop a lot more educational content around this, but there are ways to discriminate between the two brands there.
Okay, thank you. Thank you for those explanations, and I hope that answers your question, Scott. Okay, so Kyle, why did you pick this corrective strategy for this athlete?
So this corrective strategy for Ann, this could be something that again is integrated into part of her warm up. So it could be something that she begins with this as she is moving into that preparing for either performance or preparing for training, but it could also be used as part of the recovery strategy. It could be used, possibly as she's getting ready for bed or before bed, maybe half an hour before bed or so. This could be something to help calm her down or sort of, bring her back down a little bit, because it is focused so much on breathing. And we are making some assumptions here as well. One of the main assumptions is with Ann being a professional athlete, we assume that she has more kinesthetic awareness. We also assume that she has a little bit more knowledge about her body. While most professional athletes don't have detailed knowledge of anatomy and physiology, they do oftentimes understand much more than general population client. So whenever we look at these inhibition strategies, and this program here too is all focused around breathing. So Kevin mentioned back in webinar 2 that there can oftentimes be some mechanical restrictions. So if we really want to try to maximize that breath training, we need to make sure we reduce those mechanical restrictions first. These are going to be things that Ann can do on herself. So whenever we start off here with the SEM, so the sternocleidomastoid, so these, all the muscles listed up here, the SEM, the scalene, the pec minor, these are all those secondary respiratory muscles. They're going to be lifting up here on the rib cage. And if we want the diaphragm down here to be able to do its job, we have to make sure that these here relax. So getting into the SEM and the scalene, so we can work these two together. What I would teach her to do is use the back of her hand here to apply pressure into this side of her neck here. So I wouldn't want to use a thumb to jam in there. I wouldn't want to do that type of stuff. So just the back of her hand. And what she'd do is sort of drag down and then go through a little bit of a release technique as she's activating the other way. So this would be a slow motion. This is a great way to get the SEM. We could go a little more anterior to try to get the SEM. One of the other things we can do with this approach, if we take the back of the hand, we can apply pressure backwards. You can see what I'm doing there as we rotate away. And this right here is a great sort of a fascial technique to just try to get a little bit of relaxation and a little bit of mobility through those tissues. For the pec minor, I would not do this to Ann, but you could teach her to just reach up underneath to grab the pec minor here. It's lateral of the breast tissue. You find the pec minor and you can just hold that pressure there to relax it and release it. This right here is something great to do laying supine. She could be laying in bed, laying on the floor, whatever. She grabbed the muscle there. Here we would just squeeze it, apply pressure. Typical things here, also messing around this area of pec minor. If you feel a heartbeat or a tingling or a shooting pain, anything like that, then you would just want to release the pressure and try to find a different spot. Whenever we jump down to the diaphragm massage, this is another one we can show her how to do herself. I'm going to angle my camera down a little bit. This is great to do seated, but you would just take your fingers and you would put them right around the bottom ribs here. If I'm seated, I could put a little pressure into that. Once you apply pressure, maybe up to the second knuckle around that, just breathe. This right here could be big, deep breaths. This is going to use the movement of the diaphragm to help massage the diaphragm. You can also move the fingers side to side underneath here, and it's just a diaphragm massage. We're going to get it ready to fire and do its job. Whenever we get to the lengthening there, some of these release techniques that we used here, that is part of the lengthening. So we could actually skip this, or you could go through another, just some sort of a stretch to open up the anterior aspect here and try to get some of that extension and extensibility. For activation, we would use the breathing. That's an excellent activation technique. And remember the coordination of the breath. It's not just the diaphragm that we're working. As we inhale, we get that activation of the diaphragm, but as we exhale, we should get activation of the transverse abdominis and the pelvic floor. So we could use that for activation. And one of the things I really like to use here for an integration is taking that movement and taking that breathing and now coordinating it with some movement. I like the quadruped hip rocking, so they're down on all fours. The way I would coach this, we just worked on breathing, so we could take whatever strategy we use there. As you're rocking back, as you're going into more hip flexion, we would want to take a big deep breath in and sort of relax everything. And then as we're coming forward out of that is when we would exhale. I would encourage somebody in this movement to start by activating the pelvic floor as we start to exhale, coming all the way up. Whenever we're rocking forward, we should be at the end of that 4 seconds if we're using the square method. They could hold that there and then rock back. But Ann could also do this in a standing position. So she could do something like a squat to row with cables or tubing, but I would really try to emphasize coordinating that breath with the movement for her.
Okay, thank you. Thank you very much for that explanation. And that looks like a really good warm-up, cool down for an athlete to use. Now, before we're backing up to the end of the hour, so we are giving away a free CES course today. So what I'd like those of you to do who are still hanging on with us, go ahead and start to just let our producer back there, Greg, know that you are interested in a free CES course. Start to put your name in the chat box there, and he will be the one responsible for picking you. I wash my hands of that. It's all up to Greg now. So let's go to the final slide and talk about the Fender third case. Well, this guy, Patrick, looks like he's a manager. He looks like he works in a basement, and he's a candidate for burning his office down. Has moderate stress, long periods of sitting. He may be a little bit of overweight, a combination of eating diner food and that stress. He appears he's a pre-diabetic, has high blood pressure. Kevin, can you talk about his biometrics?
Yeah. Patrick is the one that has tried lifestyle change multiple times and just couldn't quite figure it out. Used to using that little number on the scale to reinforce his progress, start a lifestyle change program, and just couldn't maintain it, couldn't get the reinforcement it needed. So, Patrick's a generally decently healthy guy, maybe not by the picture there, but heart rate variability is below average. Definitely something we want to focus on. But being overweight and pre-diabetic and high blood pressure is having systemic effects on his endothelial system and his pulmonary systems, and it's increasing his risk of many diseases.
Okay. And so what is this? So we're talking about, is this his elevated respiration? And can you talk about his oxygen saturation here? Yeah.
Yeah, certainly. So the oxygen saturation, not the easiest way to explain it, but it's basically we're looking at hemoglobin, right? Hemoglobin attaches to the oxygen. How well it's attaching and dissociating in the body has a lot to do with our respiratory rate, our arterial compliance, and our body's kind of overall alkalinity. We're really acidic. We see the sigmoidal curve, and now we're going to dissociate oxygen and ineffective. So a lot also comes down to the nervous system because oxygen saturation drops as a function of respiratory rate and heart rate.
Okay. Kyle, do you have any questions or comments regarding Patrick's case? Okay. Hopefully he wins $1 million pretty soon so that he can take some time off. So let's talk about his interventions. Let's go to the last case study slide.
All right. So real quick, just on the education, this is the health and weight paradox that I see with almost all of my clients, but Patrick in particular. What he's done is basically utilize that little number on the scale. He has this assumption that he has all of these health conditions because he's overweight. He doesn't realize that he's overweight actually because he's in poor health. So every time he's tried a lifestyle program, it's all focused on decreasing that little number on the scale, where what we want to do is tell Patrick, you're overweight because you're unhealthy. Let's fix your health. A healthy body tends to follow a healthy body composition. So use these metrics, not that little number on the scale. Let's put that away for the first few phases here. Let's focus on restoring your health, your insulin management, all of these things, and that body weight is going to follow suit. When it comes to the interventions, definitely just when we see things like the pre-diabetic and the increased risk of cardiovascular disease and obesity, we want to fix their hydration. We can look at Patrick and say he looks dehydrated. So we just first want to focus on nice sustainable interventions, get him drinking a little bit more water for all the reasons we've talked about. The phase-based nutrition, this is where we really want to focus on a nice sustainable program as well. What we want to focus on in phase 1 is not caloric restriction. We want to focus on an anti-inflammatory nutrition program, perhaps a little bit of a gut restore, but more specifically, get that inflammation down. This alone is going to see improvements on his clinical markers, but he's also going to start to feel less pain. He's going to be more likely to get into the exercise phase. With that, we may at some point transition to a caloric restriction when we do want to start losing weight. He's going to lose weight just from losing some of that extracellular water and some of that inflammation. So we're still going to be reinforcing him. But with this population, we pull too many calories out. They feel hungry all of the time. This is really going to limit compliance.
Okay.
Then the postural corrections, I'll let Kyle jump into a little bit deeper. He knows a little bit more, but this is the classic, kind of text neck, maybe thoracic kyphosis going on in there. We understand we can try and get him to sleep better. We can try and fix his respiratory rate through breathing, but unless we can kind of loosen him up and kind of get him a little bit more in extension and not flexion all of the time, a lot of this is just going to kind of be a lot of effort for minimal gain. Phase-based heart rate variability training, kind of similar to what we talked about with Bob. Let's crawl before we walk before we run. So let's start with daily movement, maybe a step count threshold, but with daily or hourly movement. Then we get them into some correctives, and then we get them into more of a fat oxidation training, and then things like that. So this is all just about taking what we can get, ensuring compliance all the way along the way. And then this Pat is the type that needs the constant reinforcement. We need to be picking out little biometrics. That the AI is going to help us with these little insights each morning in the Biostrap. But at least once, twice a week, you need to be calling Patrick because he's going to be stepping on that scale, whether you like it or not. And he might be very well giving up on his program because he's seeing the weight not change or maybe even increase. Or we need to say you're sleeping better, your heart rate variability is getting better. This is what this means to your health. Have some faith in the process. It's about to happen. This Patrick's the classic case where we need a little extra holding.
Yes, he does. And for the love of heaven, people, stop stealing his stapler. So next, go ahead, Kyle, and talk about what you've done for Patrick and his corrective exercise strategy.
Yeah, so for Patrick, we're thinking of this as more like in a regular exercise training session. So we know his goals. He needs to lose weight. He needs to burn a few more calories. He needs to work on some of the heart health. He needs to work on some cardiovascular activities. And we're going to try to integrate that into a corrective strategy. Now, if people have been following along on a lot of these webinars, you may remember back from a few times ago that the corrective exercise process, it merges very well with the OPT model. Phase 1 of the OPT model is what we're going to talk about here. Quick disclaimer, whenever we talk about, Kevin mentioned the first phase of the phase-based training earlier, that doesn't, we're talking about phase 1 of the OPT model. However, I bet if we started to explore these two phases together, for some reason I feel like there would be a lot of overlap of the goals and the strategies to help him improve some of those numbers. Whenever we talk about posture here, I want you to think of this as being total body posture. So those long hours of being seated, he's definitely going to have some of the upper body stuff as well. But here we looked at also trying to encourage a little bit of hip extension. So trying to get that motion there through the iliofemoral joint, along with some of that stuff on the upper body, and also getting that movement through the ankles. So this is more of that total body. Would roll the calves, the quads. I put the star there by the glutes because we had mentioned this before, but a lot of times we can use rolling to just encourage blood flow, fluid flow, movement, tissue movement. It doesn't always have to be for inhibition. So somebody that's like Patrick here, you could spend a few seconds, a minute or so, just rolling the glutes, just getting the tissues to move. So that way you'll be able to activate them a little bit better whenever we get into some of the activation exercises in the thoracic spine. Again, getting a little bit of that thoracic extension to help open up. The lengthening techniques, standing calf, standing quad, so some of the basics there, again, trying to get more dorsiflexion, better hip extension. Here, having a half kneeling rotation. So the rotation, again, is going to, this would be a bit more of an active type of a stretch, trying to further encourage some of that thoracic movement. Then whenever we get into the activation and the core, so we see the overlap here between corrective exercise and phase one of the OPT model, I would get him again back into a quadruped position, just like we did with Ann, and work on some breathing there. So that's going to help activate those muscles the way we need. Then I'd get him back up, do some standing hip extension, so it'd be more activation there for the glutes. And with being a little bit overweight, he may not be the most comfortable getting up and down a whole lot. So that's why I also had him doing some scapular retraction from a half bent over position. Then whenever we get into the integration / resistance. So think of this as being, again, phase one of the OPT model, resistance training. So we'll program between 50 to 70% of his estimated 1 rep max. We'll use vertical loading here, so like a circuit, to where we would move through these exercises one right after the other, looking at between 12 to 20 reps. So it's not going to be something that's so high intensity that it pushes him past his level to adapt. It's still working within his level of readiness, but we're able to keep him moving. We're able to keep the blood flowing. We're able to keep the heart rate up just a little bit, and that will help him achieve some of those cardiovascular goals, a little bit of cardiovascular adaptation, and some of those weight loss goals over time as well. So that's the general strategy we used with Patrick here.
Okay, thank you for that. That is all very clear, and hopefully after Patrick gets through this, a few months of sort of training, this reinforcement, proper nutrition, he can finally enjoy that vacation on the beach. So we are at the end of up to the end of the webinar, so we can go to the slide, the final slide of this series. And while we're through this, if you have additional questions, please start sending them in to Greg now. But you can 35% on the new CES. You can use the code capital webinar numeral 25, and to redeem that, you can call 888-773-1827. That's 888-73-1827. And you can also, this is an ongoing discount from our friends at Biostrap. You can also get the PN Medical Breather Fit for 20% off using the code capital NASM 20%. And you can redeem that at pnmedical.com/products. And gentlemen, Kevin, do you have, or actually, let's start with you, Kyle. Do you have any takeaway points from today's webinar?
Takeaway points: use the data. Use the data that you have available. That we have a wealth of information that we can get access to, and make sure you use it to drive your programming strategies. I said it in the beginning of this, but just to reiterate, whenever we look at corrective, it's based on movement. So make sure you're including the assessments. The programs we looked at here, these were the programs we looked at. These were general. We did make some assumptions here. They would be effective for most of the people based on the setup that we looked at. But again, we need to combine some of those numbers, that movement improvement assessment before we really jump into corrective exercise programming.
Okay, thank you for that. And Kevin, what's your big takeaway?
Basically, we're at where this technology is available. I think we understand that optimal outcomes aren't just seeing our clients 1 hour twice a week in a gym setting. We now have the ability to remotely monitor their sleep and other aspects of their health and performance to build programs around. But the biometrics alone are not enough. Apple Watches and these have been around for a long time, and healthcare epidemics are only getting worse in our country. What we need is a front line of fitness professionals on the proactive end of healthcare, right? Preventing diseases. Doctors are going to be there to cure them. But I think, utilize these types of tools to facilitate improved nutrition and exercise habits with this reinforcement model. We have a really good opportunity to really move the needle here. The technology's there. Now we just need the healthcare professionals to take the time to learn about it and understand how to apply it.
Okay, great. Thank you. Thank you for that. And thank you both gentlemen for your contributions and your work putting these webinars together and educating us on such a short order. And the winner today for our free CES course is Becky, and I hope I'm pronouncing that correctly, Becky Carroll. Congratulations, you have won your CES course. If you could send a message to Greg, our producer, with your email address, we can get you set up with that. Okay, thank you. It's been very educational. And thank you, Greg, for doing all of your work in the background. And hopefully we'll see you all again very soon. Have a great weekend, everyone. Stay safe.